Thank you for joining North Kansas City Hospital sponsored event, Healthy Living Series, Liver Disease. So today we have a doctor that works with us that is going to go over all about liver disease and what you need to be looking for. So with that, I will hand it over.
All right, thank you very much. Hello, everybody. I'm Dr. Samuel Schowengerdt. I'm one of the gastroenterologists and hepatologists that works here at North Kansas City Hospital. And I'll be talking to you a little bit this afternoon about liver disease, what symptoms to be aware of, what diseases to be on the lookout for, and what you can do to improve your overall health from the liver standpoint. But first, a little bit about me. As I mentioned, I'm Dr. Sam Schowengerdt. I usually go by Dr. Sam to all my patients. I learned from a very young age that my last name, while not too hard to say, is very long and overwhelms folks. So Dr. Sam is a lot easier. I'm a native Northlander. I grew up north of the river. Actually, my first job was at Metro North Mall, working at the Gold Crown store in high school when that was still a thing. But my training, so I started my undergrad here at UMKC in Kansas City. Subsequently went to University of Missouri, Columbia for my medical school. I then did a little jaunt up to Wisconsin for my residency at University of Wisconsin-Madison. And then I did an additional year as a chief resident at the Veterans Hospital up there in Madison as well. And then subsequently, I did my fellowship training in gastroenterology and hepatology back here in Kansas City at UMKC to make that nice loop of the Midwest and finally back home where my family still is. So I am, as I mentioned, a GI doctor that is primarily at North Kansas City. I work for consultants in gastroenterology. We're a division of digestive health specialists. We do procedures at the hospital, but we also have an office over there off North Oak in the Creekwood area where I see patients in clinic. So getting on to liver disease, it's a very broad topic, and the liver is quite an important organ. So let's start there. What is the liver? So the liver is an organ that sits in the right upper quadrant of the abdomen. It's just below the rib cage on that side. It's about the size of a small watermelon. And so I've kind of included an image here to kind of visualize where that's at. You can see the gallbladder is very close to the liver there, but the liver is quite large. What does the liver do? So it's very important. It does a variety of different biological functions. So it has lots of blood flow from the GI tract as well as throughout the own. And so it is involved in digesting nutrients, helping with protein metabolism, lipids and cholesterol, all these type of things. It's also involved in lots of storage of our multivitamins, such as vitamin A, D, E, and K, B12, those vitamins. Also has a role in ridding toxins of the body. And so it has an important job there. It also produces some hormones that can affect our blood pressure and things like that. So while the liver is kind of this unknown organ to a lot of folks, it plays a role in so many different things that keep us healthy. What is liver disease? So it's a very general term that basically means anything that can negatively affect the liver's function. As I mentioned on the last slide, the liver has a lot of different functions that it plays a role in. These can range from completely benign, just mild elevations in liver function tests, all the way to full-blown cirrhosis. And so what are some of the causes of liver disease? Well, some of these can be inherited or genetic causes that are passed down from family member to family member, but a large majority of them are extrinsic causes. And these are the ones that people are usually more familiar with. Viruses such as hepatitis B and C can cause chronic liver disease. Alcohol has long-standing effects on the liver, as well as more recently we've discovered that obesity is a primary driver of underlying liver disease. Then what is actually cirrhosis? So cirrhosis is when the liver has become so inflamed to the point where it's inflamed and becomes scarred down and hard. The best way I kind of describe this to my patients is that when you get a cut on your hand or something like that, the skin that comes back in that spot where you had the cut is a little bit different. It's not quite as pliable. It's a little different color, sometimes a little bit harder, things like that. Well, in the liver, what happens is long-term inflammation in the liver goes through inflammation and healing. And through this process, the liver becomes more scarred down and fibrotic. And that's what cirrhosis is. And what are some of the symptoms or complications of cirrhosis? And these may be some that you're familiar with and some that you're not as familiar with. People are often have heard of the yellow jaundice, which is yellowing of the skin or eyes. That's related to bile that the liver produces that builds up in the system when the liver is sick and can cause the yellowing of the skin and eyes and things of that nature. Ascites is another thing that people maybe heard of. It's associated with kind of the beer gut or the beer belly, where the abdomen is full of fluid that builds up, and this fluid is called ascites. Additionally, a very general term, fatigue is common in advanced liver disease. People oftentimes have significant bruising and bleeding if their liver is not functioning well. A condition called hepatic encephalopathy, hepatic meaning liver, and encephalopathy meaning confusion, can occur with advanced liver disease where patients are just confused and have memory issues. Varices, which are these dilated vessels that can occur in the GI tract, similar to varicose veins that people can get in their legs, can occur. And then finally, the most dreadful complication of underlying untreated cirrhosis is it can actually develop into cancer of the liver. So these are all things that the liver can have go wrong if it's untreated and unrecognized. What are some various risk factors for liver disease? So, as I mentioned, heavy alcohol use can cause chronic underlying liver problems. Obesity, untreated, can cause underlying fatty liver disease. Diabetes, history of drug use, family history of liver disease. Additional things to be considered of is blood transfusions that were given prior to 1992 when we didn't know about screening for hepatitis B and C prior to this, as well as a history of tattoos or piercings. And then how can I be screened for liver disease? Well, in general, most patients, if they get routine lab work through their primary care provider, part of that will include some electrolytes, kidney function, blood work looking at if they're anemic. It usually also includes what are colloquially called liver function tests or LFTs. Other things to be aware of is this is a fairly newer recommendation as of 2020, but the United States Preventative Task Force now recommends that all adults over the age of 18 be adequately screened for hepatitis C. The reason for this was prior to the 2010s, we really didn't have good treatments for hepatitis C. It was out in the community, but most of the time didn't always progress on to cirrhosis, and the disease was not as bad as the cure. The treatment was very painful. But nowadays we have adequate treatment, and we're trying to screen for these folks that otherwise did not realize they had hep C, so we can treat them and prevent the progression of chronic liver disease and cirrhosis. And then what if my liver tests are abnormal? So most of the time when I see patients in clinic for these referral, it's not a serious condition, but it does require additional workup. And so what are things that can cause some mild elevation in these liver function tests? Well, there are certain medications that patients are oftentimes on, such as cholesterol medications such as simvastatin or rosuvastatin. These medications can cause mild elevations in liver tests, what we commonly see. Sometimes antibiotics for any reason can also cause some issues. People are oftentimes familiar with, or at least somewhat aware, that Tylenol is processed through the liver. And so if individuals take excessive amounts of Tylenol, particularly if they're drinking alcohol, it can cause damage to the liver as well. So what is non-alcoholic fatty liver disease? So NAFLD, as it's oftentimes called, is an increasingly common cause of abnormal liver function tests in the United States. It is particularly associated with a syndrome called metabolic syndrome. Metabolic syndrome is a condition that's associated with multiple fairly common medical issues. This includes diabetes, high blood pressure, central obesity, which is increased fat storage around the abdomen in particular. Sleep apnea is associated with this, high cholesterol, high triglycerides and fats in the system, all make up this condition called metabolic syndrome. How is non-alcoholic fatty liver disease then diagnosed? Well, it's usually a combination of various things. It's taking into account the patient's history, seeing if they have one of these underlying conditions that's associated with it, looking at their lab work and seeing what their liver function tests look at, and then usually a combination of imaging as well, such as ultrasound, CT, or MRI to review the appearance of the liver on imaging. How is this underlying non-alcoholic fatty liver disease treated? Well, it's all the stuff that we know we should do, but is not as easy to do on a regular basis. Getting plenty of aerobic activity, 30 minutes a day, at least 3 to 5 days per week. And then a Mediterranean diet has also been found to be helpful with this. Mediterranean diet is becoming a more popular diet for individuals with underlying heart disease, diabetes, and things like that. And it is involved basically from the idea of trying to eat a diet that's more common in the Mediterranean, such as Italy, Greece, and those countries. We found that their diet is higher in plant-based oils such as olive oil, more natural grains and vegetables, less processed white grains and white breads, less red meat, more lean meat and fish and things of that nature have been found to be helpful for non-alcoholic fatty liver disease. Other things, regular weight loss. The goal is not quick weight loss, but progressive weight loss over time. So 5% body mass over 6 to 12 months. We also try to avoid causing anything else that may exacerbate underlying liver disease. So we recommend immunization to hepatitis A and B. Also trying to minimize alcohol intake. And then always consulting with your doctor prior to taking any non-prescribed medications or supplements. It's not uncommon for patients to want to be on a supplement to help with arthritis or any other conditions that may have a negative effect on the liver. And some of these are proclaimed as natural supplements, but always talk with your doctor before taking any of them. So with that, I will go ahead and open it up for questions regarding the liver.
Thank you so much, Dr. Sam. Okay, so if you have any questions, you can go ahead and enter those into the Q&A in the chat. I found it very, very interesting because, I mean, commonly, Dr. Sam, when at least I hear about any sort of liver disease, it is all has to do with alcohol consumption. So being able to hear the different factors that go into getting liver disease, I think is very, very good.
Yes, and so I oftentimes will tell my patients that, alcohol is usually thought as, oh, that's if someone has liver disease, that's the issue. But as I mentioned, we're seeing more and more of this non-alcoholic fatty liver disease, which is associated with pretty common conditions, blood pressure, diabetes, cholesterol issues. And that's what we're seeing more and more commonly with our referrals for abnormal liver tests or underlying liver disease. And then, as I mentioned, the other thing is making sure that you've been appropriately screened for hepatitis C, because most people with hepatitis C do not realize they have it, maybe don't even know where they maybe could have contracted it, but that's why we're trying to find these individuals with those new recommendations in 2000.
Okay, and if somebody wanted to get a hold of you to make an appointment with you, how would they go about doing that?
Oh yeah, let me go ahead and go to the next slide. So as I mentioned, I'm a gastroenterologist and hepatologist. I work primarily at North Kansas City, but our offices are located over in the Creekwood Clinic Center. I have my address there below, as well as our phone number for our offices. But we see a wide variety of folks with various liver diseases. As I mentioned, it ranges from just routine lab work that shows mild elevation in liver function tests, folks with a family history of chronic liver disease that want to be counseled or further evaluated, individuals with that actually do have cirrhosis as well that we see in our clinic. So we see a wide variety of individuals with underlying liver issues.
Dr. Sam, are you currently doing the virtual appointments?
So our office does have the availability to do telemedicine and virtual appointments there. I haven't done them as frequently as when we were in the heart of the pandemic, but yeah, we do have that availability through our office.
Okay. And I have one last question for you. You mentioned hepatitis C. Is this something that gets that you get tested with your annual blood work, or what is the concern like that I should be looking out for needing to be tested for this?
So yeah, it is, like I said, a fairly recent update to the recommendations from 2020. Prior to 2020, they had made the recommendation, I believe, in 2013 that individuals born between 1945 and 65 be screened. And so anytime there's new updates that come out, it takes a while before the everyone gets educated about those. And so I know about it because this is my field, but it would be something to ask your primary care doctor, like, hey, do I need to be screened for hepatitis C when you have your routine follow-up and are maybe getting routine lab work? Because as I mentioned, it's such a new change that some of the docs may not be aware of this update. And so things with hepatitis C, most people are asymptomatic. And so that's the thing, is you may not have any symptoms, and it may just come positive on some blood work. And if that blood work, does show some positivity, we have thankfully good treatments nowadays that result in cure in most people in about 98% of the time with very minimal side effects. Treatment usually is between 2 to 3 months of treatment for the hepatitis C, but definitely something you should talk with your primary care doctor if you would meet criteria for screening for hepatitis C.
Okay. Well, thank you so much. I think that's all the questions that we have. I greatly appreciate you taking time out of your busy schedule and day to talk with us about liver disease. I know it was very enlightening for me.
All right. Well, thank you very much. Everyone stay safe with the upcoming storms. Bye.
Bye.